Hello friends and welcome to the next episode of Concept का खेल. Just to summarize Concept का खेल क्या है? Concept का खेल is uh, showing you the important concepts from the subject of forensic medicine which are repeatedly asked in the examinations, or important concepts which are the details of which are very important for every student who's preparing either for FMGE or NEET PG or INICET examination, so that their concepts are well strengthened, and whenever a question come on the relevant concept जो हमने पढ़ा है, right, we can answer the question with confidence. ओके, सो कॉन्सेप्ट के खेल में आज हम कौन सा कॉन्सेप्ट देख रहे हैं? आज हम देख रहे हैं कॉन्सेप्ट कॉल्ड एज बिवेलिंग ऑफ स्कल इन गन शॉट वुंड्स, राइट? तो आइए देखते हैं व्हाट इज बिवेलिंग ऑफ स्कल और ये किस तरीके से होती है और इसका मेडिको लीगल इम्पोर्टेंस क्या है. We start with mechanism of production. Okay, so how beveling is produced, right? So beveling is produced by a bullet which enters the skull while spinning on its axis. So we know when rifled firearms are shot, the bullet comes out spinning on its axis, and this creates a punch out neat hole in the outer aspect of the skull, while a bigger hole in the inner aspect of the skull. Okay, so we can see the skull being a thicker bone जिसके दो डाइपोल हैं. The outer aspect of the skull has a very neat punched out kind of appearance, and the inner hole which is created on the inner aspect of the skull, it is a bigger hole, right? ऐसे पहचानने से हमें क्या फ़ायदा होने वाला है, इसकी मेडिको लीगल इंपॉर्टेंस क्या है? तो इसकी मेडिको लीगल इंपॉर्टेंस है दैट आइडेंटिफाइंग एंट्री होल और एग्जिट होल बाय करेक्टली आइडेंटिफाइंग बिवेलिंग. तो अगर हमें बिवेलिंग पता है तो हम एंट्री होल और एग्जिट होल स्कल में करेक्टली आइडेंटिफाई कर पाएंगे. So let's see what exactly is beveling, how is it created, and how beveling is different in entry and exit wounds in the skull. So let's see. Let's assume that this is the gun which is going to be used to shoot a bullet. And let's say this is the bullet that comes out of this gun, and this bullet is revolving on its axis. And as this bullet is going to strike the skull, let me draw the curvature of skull here, right? The skull having an outer aspect and the inner aspect. Okay, so we have outer aspect of the skull, we have inner aspect of the skull. Now this bullet which is moving to hit the curvature of the skull, right, it is moving on its axis. So consider this all action like a drilling machine, जो ड्रिलिंग मशीन हम यूज करते हैं वॉल में ड्रिल करने के लिए, राइट? सो स्कल ड्रिल्स थ्रू the outer curvature of the skull. So when it drills through the outer curvature of the skull to enter into the brain, uh, it creates a track which looks something like this. And after creating the track, what will happen? We'll find that the holes in the skull, they will look like this. And the bullet has entered into the brain space. So you can say that this area is brain, right? So what we can see, as the bullet has moved into the skull, it has created openings in the outer table of the skull as well as the inner table of the skull. But the opening in the outer table of the skull is very small, whereas the opening in the inner table of the skull, as you can see here, this is big. So this opening is small and this is big. We can say it may look something like this, right? With telescoping of the edges inwards. Edges telescoping inwards. This is called as beveling of the margins of the skull. Okay, this concept is called as beveling of skull, right? So as you can see, when the bullet was moving from outside to the inside of the skull, the margins were telescoping inwards. Okay, this is called as beveling in, right? Now let's consider what will happen if the bullet will be moving out of the skull. Okay, so let's say the same bullet which has now moved into the brain, it creates a track through the brain to now exit from the other side of the skull. So here is the same bullet which is now in the brain space, and now it is moving out. So as this bullet will be moving out, it will first hit the inner table of the skull. So it will first hit the inner aspect of the skull and creating a track through the inner aspect of the skull, it will exit out, right? As a result, now you will see that bullet will create a track like this. If we will see what does this track look like, it will now look like the reverse of what we have seen earlier. Okay, so when we will see the skull matter now, there will be a smaller hole inside of the skull and there will be a larger hole outside of the skull, right? Just the reverse of the entry happens at the exit side. So here we see a small opening inside and a bigger opening outside, right? This concept is called as beveling out, as the margins of the skull are telescoping outwards. ओके, तो हमें क्या दिखा? बिवेलिंग इन में एक नीट स्मॉल पंच्ड आउट ओपनिंग होगी आउटर टेबल ऑफ द स्कल पे, राइट? और बिवेलिंग आउट में एक नीट पंच्ड आउट ओपनिंग होगी इनर एस्पेक्ट ऑफ द स्कल पे, राइट? छोटी ओपनिंग बाहर है और बड़ी ओपनिंग अंदर है, तो वो बिवेलिंग इन है। छोटी ओपनिंग अंदर है, बड़ी ओपनिंग बाहर है, तो वो बिवेलिंग आउट है। तो बिवेलिंग को करेक्टली आइडेंटिफाई करके we can say which one is the entry wound, which one is the exit wound. This is the concept of beveling of skull in gunshot wounds. Let's see one MCQ regarding the same phenomenon. Now when you will read this MCQ, you will be able to answer the MCQ very easily. A person is shot on the head few centimeters above the right ear. Which ear? Right ear. by a shooter who is standing 1 meter away from him. So the shooting has been done from a certain distance. It is not very near to the person. At autopsy, two holes are seen in the skull, one on the right side of the head, one on the left side of the head, which will suggest the doctor which one is entry wound, right? So now we know the concept of beveling on the skull. Okay, looking at the options, which are beveling in on the right side of the head, or beveling out on the right side of the head, or beveling in on the left side of the head, or beveling out on the left side of the head. Okay, so because the bullet has entered from the right side, as the bullet has entered from the right side, फाइंडिंग्स क्या होंगे स्कल में? फाइंडिंग्स इन स्कल, नंबर 1, beveling in on right side, and number 2, beveling out on left side, right? So what will help the autopsy doer to identify which one is entry wound, right? This is the question. So answer is beveling in on the right side of the head. That's what we wanted to discuss in this session. I'll see you around in the next concept of Concept Ka Khel. Till then, stay tuned.